Hello, everybody. Thank you very much for joining us on the 8 Questions in 8 Minutes episode. And today we're going to discuss a bit on CKD. The global prevalence of chronic disease is increasing with the age of the population worldwide. As kidney function declines, the accumulation of metabolic waste products and excessive electrolytes can significantly impair the health of patients with CKD. As nutritional management of patients with CKD is thought to control uremic symptoms and provide beneficial effects of the progression of kidney dysfunction, the diet of the patient with CKD should be an important consideration in their care. And for that, today we're going to focus with Dr. Melissa Prest, who is a foundation dietitian at the National Kidney Foundation of Illinois. She's a board certified as a specialist in renal nutrition and has a certificate of training in adult weight management. Melissa, thank you for joining us today. It's a pleasure.
Thanks for having me.
So the big question is how to navigate the challenges of CKD. Just a quick, fast question before we dive into the 8 questions. How do we navigate? It's really too difficult, right?
There's a lot going on with chronic kidney disease because it's not just chronic kidney disease. It's always chronic kidney disease and another chronic health condition. Exactly. Diabetes, high blood pressure, they're the 2 leading causes. So typically individuals with chronic kidney disease are also managing some other health conditions. So it requires a lot of doctor's visits, medications, diet changes. So there's a lot that's going on there.
And individualization becomes a bit of a challenge there, right?
Yes, yeah, for sure. It's kind of taking in preferences, what's going on with the lab results or the other health conditions. There's a lot of customization or individualization that has to take place. Great.
We're going to dive into our first question. Question number 1, how does CKD affect nutrition and what are the headlines that dietitians should look for when facing such patients?
Yeah, so with CKD, there's changes that we make in the diet composition or what we're doing with recommendations for the diet as the disease progresses. So typically those earlier stages we're really focused on overall health, maybe managing other health conditions. But once we get to 3 and 4, we start modifying the diet for the kidney itself. The other challenge with that is that patients might start to have more nausea and vomiting as that uremia increases. That can cause some issues with eating. And so typically we might see patients that are more malnourished as they get to the later stage of kidney disease than someone who was in earlier stage with kidney disease. And then sometimes just the diet restrictions and understanding them can be very confusing and challenging for patients. And so I find oftentimes that they're over restricting when they don't need to be, and that's causing unintentional weight loss and, problems related to that.
Awareness at that front is really very important. Let's dive into the second question. To provide optimal care to patients with CKD, it's essential to have an understanding of the applicable nutritional principles, methods to assess the nutritional status, establish patient-specific dietary needs, prevent or treat potential ongoing nutritional deficiencies and their arrangements. How do you prioritize and what challenges you face in practice and how do you overcome those?
We obviously want to make sure that we are doing an assessment that includes nutrition-focused physical exam. We're looking at those laboratory values. And then we're also asking the patient, how is their appetite? Are they understanding what's going on with their diet? What questions do they have? And really based on what's going on. So whether it's a lab value or if it's maybe just a physical symptom, maybe they're having more fluid and edema, maybe they're complaining of nausea and vomiting, fatigue, we're going to kind of prioritize based on what's going on with the patient. If they're feeling fine, then we want to make sure that we're kind of looking at what's going on with their diet and making some of those changes. But if I have someone that's telling me, I can't eat anything, I don't feel really well, we're not going to be as strict with them in the diet, and we're going to focus on how can we get them any type of food and nutrition so that we can get them back to a healthier state, and then we can refocus on some of those diet changes.
More on quality of life there, right?
Right. Always important. Quality of life is always important.
Brilliant. Let's move into our third question. Is CKD reversible by diet, knowing that the challenges associated with it, including high blood pressure, anemia, weak bones, poor nutritional health, and nerve damage?
Well, some people may have some reversal or even improvement in kidney function. In general, once someone has kidney disease, they will always have kidney disease. Particularly as we get older, we have that decline in kidney function. That's just kind of a natural thing that occurs. But I definitely have had patients that have had improvements in their GFR and creatinine just by doing some diet and lifestyle changes.
I see. Let's move into our fourth question. Protein-free products have been around for quite a while, and it's known that a low-protein diet is beneficial for CKD patients, probably at the level of 0.8 grams per kilograms per day. Now, which approach you prefer, the protein-free or the low-protein diet, and why?
Usually the lower protein diet, we want to be cautious of the fact that if we're not really doing a lot of protein, we could also cause malnutrition and cause nutritional deficiencies. So it's always that kind of balance that we're doing, a little bit of like this, kind of balancing act between making sure they're healthy, we're making sure the kidneys, we're not pushing where we're declining the kidney function, but then we're also not causing malnutrition at the same time. So that's always been a little bit of a challenge when we look at the literature with the low protein diet and malnutrition, and we want to make sure that we're not doing that. So I think rather some of the protein free or the lower protein are things we can include in the diet, but we want to make sure that we're also getting good protein sources when we are eating our protein foods.
Lovely. Fifth question. What is your take on supplements, knowing their advantages of having essential amino acids, but at the same time they contain keto acids and their impact in suppressing protein degradation? How do you overcome such a dilemma?
Well, there's definitely been some great research that shows a very low protein diet. So, kind of as you had said earlier, about 0.8 or 0.6 to 0.8 is kind of that low protein diet, grams per kilogram of body weight. But there is research looking at keto analog supplements with a very low protein diet, and that could be 0.35, 0.4 grams per kilogram. And there has been some great research that supports that use for delaying kidney function, that decline in kidney function. I think, again, you had to kind of weigh those balances with the patient. Like, is that appropriate for this patient? All these recommendations and the protein recommendations and what we're doing is really in patients that are metabolically stable. So there's really nothing else kind of going on, or the other health conditions are well managed. But if you have someone that has cancer, has, significant weight loss, has other things going on with them, it may not be appropriate at that time to really do a very low protein diet or low protein with keto analogs. So you always have to kind of assess if that patient is metabolically stable or not, and whether those recommendations are appropriate. But there is research that definitely supports the keto analogs with the very low protein diet.
Brilliant. Let's move into our sixth question. What kitchen measures do you recommend as practical issues for nutritional management of CKD? It's an advice that dietitians can give to their patients. So what kitchen measures do you recommend as practical issues for nutrition?
Like with like cooking, like in the kitchen? Yeah. So with that, obviously we always talk about cooking from home, trying to cook foods that are fresh, just meaning that it's more in its whole state as opposed to in a packaged form. And that really allows you to control the amount of salt that's in that food product, right? Because salt's a big one. So we want to flavor our foods with more herbs and spices, less salt. Most of the salt in our diets typically comes from these packaged foods. So even if there was a little bit of salt added at home, it's much less than we have in packaged foods. So choosing whole foods, cooking foods at home, using herbs and spices, as opposed to salt, and even using like an acid, lemon, pineapple, vinegars, those kinds of things can help give that flavoring we get from salt without getting that salt content.
Lovely. Let's move to our seventh question. When advising on practical issues for food selection, what is your take on grains, beans, oils, and fats and vegetables? And do you encourage the use of spices to replace the salt, which you just mentioned?
Yeah. So obviously I definitely encourage the spices in place of salt. And all the research that's really come out that's looked at legumes and pulses in the diet, vegetables, whole grains, we have those older recommendations that were saying eliminate all of these from our diets. And now there's a lot of benefits to adding these back in the diets. It's great for the gut microbiota, which we know can be, dysbiosis with the chronic kidney disease process. So having these grains and pulses and in the diet can really help with that gut microbiota, help with constipation, which happens a lot with individuals with CKD, with the decrease in fluid or the medications. We just want to be mindful if we have a lot of potassium, right? So the phosphorus content in these foods, we're not absorbing that much of them, but the potassium content, we just want to be mindful of it if we're seeing some changes in potassium level. But even research is showing that the amount of potassium we're eating maybe isn't necessarily driving that potassium. It's other things. So again, choosing foods in the more whole form, less refined. I definitely encourage patients, to go ahead and enjoy those foods. And then we just monitor their lab values.
Yeah. Anyway, salt in packaged food has a different purpose. It's more for conserving the food, but in the kitchen, it's for the taste. So we have different priorities there. So let's move to our 8th question. How do you deal with difficult CKD patients? This is a question on everybody's mind, and they are challenging to educate, especially to recommend diet plans also, and more than that, to monitor. What's your intake?
Yeah, with our patients, sometimes it takes a while to build rapport with them. I've definitely had patients where it's probably taken almost a year to really build some rapport with them. It's always good to meet someone where they're at. Think about something like motivational interviewing, where you can just see if you can have the patient come up with solutions for themselves or see where they're at. Even if it is just some goal setting, what is their goal? What's their motivation? I had a patient who, we were struggling with phosphorus, wasn't making the best food choices, and was refusing to go on a phosphorus binder. So we kind of worked with, okay, your goal is not to go on a phosphorus binder. How can we do this? And so it's just finding these little ways to kind of work with the patient. It's not going to happen overnight. You just have to kind of go slow, try to build rapport with the patient. It might be that your meeting with the patient is just kind of having more friendly banter and then asking permission. Can we talk about your lab values now? Is now a good time? When can we talk about this? I have this concern. What are your thoughts about this? So really kind of always trying to have the patient's voice in there and pulling out what their goals and concerns, because oftentimes these difficult patients may be difficult for us, but they're dealing with things at home. They're dealing with all of these emotions surrounding dealing with a chronic illness, and it's unrelated to us. And so it's, trying to meet them where they're at, stay in it, and eventually you'll kind of break through.
I mean, it's a state where they have to, do some acceptance there. And it's really hard when it comes to accepting that new situation. So this dilemma that they live in can result in a lot of aggression, a lot of refusal, a lot of, attitude issues when it comes to patient management. Melissa, thank you very much for joining us today on this program. And we'd love to see you in the Middle East very soon. So until then, best of luck. And thank you, everybody, for taking the chance to listen to our discussion. Thank you very much.
Thank you so much.
See you on the next episode. Bye-bye.